Hello, young ladies and gentlemen. I'm Dr. Joseph Butler, your geriatrician. And today I want to talk to you about a pattern that appears every single year across hospitals in the United States. Something so consistent and so alarming that it deserves more attention from all of us, especially those of us aged 50 and older. As soon as the holiday season arrives, as Christmas decorations go up, as families start planning gatherings, and as the end of the year draws near, emergency rooms begin preparing for what has become an unfortunate tradition: a significant spike in heart attacks. Christmas Eve, Christmas Day, and New Year's Day are among the highest risk days of the entire year for heart attacks. This isn't a myth. It isn't a coincidence. It's a well-documented medical reality, observed year after year in countries around the world. And the question many people ask is, why? Why would heart attacks increase during a season that's supposed to be joyful, peaceful, and heartwarming? Well, the answers are surprisingly clear, and today I'm going to walk you through them, slowly, carefully, and in a way that empowers you to stay safe, aware, and healthy this year. Let's start with the first major factor: our behavior during the holidays. For many people, the holidays are a time of indulgence. We eat richer foods, heavier meals, saltier dishes, sugary desserts, and larger portions. We drink more alcohol at gatherings, office parties, family dinners, and New Year's celebrations. And while enjoying food and drink is part of the season, the cumulative effect can be dangerous for someone with underlying cardiovascular issues, even issues they might not be aware they have. When you consume a large, high-fat meal, your blood becomes temporarily more viscous. Your triglycerides increase, your blood pressure rises, and your heart must work harder to pump that heavier, nutrient-rich blood. Alcohol, on the other hand, raises blood pressure, destabilizes heart rhythm, disrupts sleep quality, and can trigger episodes of atrial fibrillation, especially in older adults. Combine these with decreased physical activity, long hours sitting at the table, and multiple days of indulgence, and you create a perfect storm inside the cardiovascular system. And that brings us to the second factor: stress. Now, many people imagine the holidays as a stress-free season full of happiness. But for millions of Americans, especially older adults, the holidays are emotionally complex. Stress levels rise due to social obligations, financial concerns, family expectations, travel demands, crowded environments, and the emotional weight of memories, anniversaries, or loved ones who are no longer with us. The season can amplify feelings of loneliness, sadness, pressure, guilt, or responsibility. When your body experiences emotional stress, your adrenal glands release cortisol and adrenaline. These hormones increase heart rate, raise blood pressure, tighten blood vessels, and elevate inflammation throughout the body. Emotional stress can destabilize plaque in the arteries, making it more likely to rupture. And plaque rupture is the primary event that triggers most heart attacks. Even a single stressful day, like a tense family gathering, overwhelming travel experience, or unexpected argument, can overload an already vulnerable heart. Now let's look at the third factor: cold weather. Winter temperatures can have a dramatic effect on the cardiovascular system. When cold air hits your skin, your blood vessels constrict automatically to preserve heat. This constriction increases blood pressure. It forces your heart to pump harder. It raises oxygen demand. And it can be enough to push someone with coronary artery disease into a dangerous situation. Cold weather exertion is especially risky. Shoveling snow, lifting heavy boxes, walking long distances in the cold, or climbing stairs while bundled up. All of these activities force your heart to work harder in an environment that is already increasing vascular resistance. For many Americans, these activities occur suddenly, without warm-up, without preparation, and often after a week or more of poor sleep, overeating, and emotional stress. It's easy to see how these elements combine into a high-risk scenario. But now we come to the final factor, the one that doctors consider the most heartbreaking: delayed care. This is the silent killer of the holiday season. People feel symptoms: pressure in the chest, shortness of breath, nausea, back pain, fatigue, dizziness, arm discomfort, but they tell themselves, "I don't want to ruin Christmas." Or they say, "It's probably just something I ate." Or, "It's the holidays, I'll deal with it later." Or, "I'm too busy right now." And because they wait, what could have been a survivable cardiac event becomes fatal. Time is heart muscle. The sooner we intervene, the more heart tissue we save. A person who presents within the first hour of symptoms has a dramatically better prognosis than someone who waits 6 hours, 12 hours, or overnight. Yet holiday culture, family dynamics, and social pressure lead many people to ignore or hide their symptoms. This is why awareness is so important. Heart attack symptoms in older adults, especially women, can be subtle. You may feel discomfort instead of pain, pressure instead of sharpness, fatigue instead of tightness. You might feel jaw pain, shoulder pain, back pain, indigestion-like sensations, dizziness, nausea, or simply a sense that something is off. Some patients describe it as a heaviness, a squeezing, or a strange anxiety. If you ever experience these signs, do not wait. Seek help immediately. Now, the good news. You have tremendous power to protect yourself, and the steps are simple. First, maintain or increase your physical activity. Movement is medicine. Even just 20 minutes a day of walking, stretching, or gentle indoor exercise can improve blood flow, reduce inflammation, help regulate blood sugar, stabilize blood pressure, and lift your mood. It doesn't need to be intense. It doesn't need to be perfect. It just needs to be consistent. Next, do not skip your medications. During the holidays, normal routines fall apart. We travel, we go to parties, we forget schedules, we stay up late. But missing medications, especially blood pressure medications, cholesterol medications, or blood thinners, can significantly raise your risk. Set alarms, use pill organizers, keep medicines in your carry-on if traveling. Make them a priority. Also, prioritize sleep and mindfulness. When you sleep poorly, your cardiovascular system suffers. Cortisol increases. Blood pressure rises. Heart rhythms destabilize. And when you add alcohol, caffeine, and late-night meals, your sleep quality drops even more. Try to create a consistent sleep routine. Keep your bedroom dark and cool, and avoid heavy meals too close to bedtime. Give yourself a few minutes of quiet breathing, gratitude, or relaxation before sleeping. Even a short mindfulness practice can help regulate heart rhythm and calm the nervous system. Most importantly, do not ignore symptoms. If you feel pressure, pain, nausea, shortness of breath, cold sweats, heavy fatigue, or anything unusual, call 911. Do not drive yourself. Do not wait until after dinner. Do not assume it will pass. Acting fast is the single most important factor in survival. Now, let's talk about how to enjoy the holidays safely. Eating mindfully is key. You don't need to avoid holiday meals, but you can be strategic. Reduce portion sizes. Add vegetables to your plate. Eat slowly. Stay hydrated. Avoid arriving at gatherings extremely hungry. Drinking water between alcoholic beverages can help maintain stable blood pressure and reduce strain on the heart. Managing stress is essential. Take small breaks during social events. Step away from noise and activity when needed. Give yourself permission to say no. You are not responsible for making the holiday perfect for everyone else. Protecting your health is not selfish. It's wise. Stay warm when going outside and avoid sudden strenuous exertion. Many heart attacks occur when people perform intense activity in cold temperatures without warming up. Move gradually. Pause often. Listen to your body. Stay connected emotionally as well. Loneliness raises the risk of heart problems, especially in older adults. Reach out to someone. Make a phone call. Visit a neighbor. Join a community or church event. Human connection supports emotional health, which in turn supports cardiac health. As we bring all of this together, I want to emphasize something deeply important. Your heart doesn't know it's Christmas. It doesn't know it's New Year's. It doesn't know you're hosting dinner, traveling, shopping, or trying not to upset your family. It only knows the physical reality it's experiencing: stress, cold, fatigue, heavy meals, alcohol, missed medications, or ignored symptoms. Your job is to listen to your body. Your job is to protect yourself. Your job is to respond quickly when something doesn't feel right. Movement is medicine. Mindfulness is protection. Awareness saves lives. So please, share this message with your family, your friends, and your community. Someone you love may be at risk and not even realize it. Thank you for watching. I'm Dr. Joseph Butler. Take good care of yourself, stay warm, stay active, and I'll see you in the next video.
Join us on Healthcare Seniors.
Amen. Be part of our community and watch the next video.